My interest is also in improving access to early diagnosis, support, and quality nursing care for patients with autism. My outline is as follows. Persons with autism experience disparity in healthcare service delivery and utilization, despite the fact that this special group of children or individuals frequently have problems with gastrointestinal condition, gastrointestinal condition, epilepsy, and other mental health problems. It is difficult for them to access proper healthcare services and receive quality care. Autism is a developmental disability which occurs as a result of atypical development that alters normal development in children. And the core symptoms include difficulties in communication and social interaction, as well as repetitive behavior and interest. Its prevalence is increasing globally. In 2014, CDC reported that 1 in 68 American children were on the spectrum. In Africa, however, the prevalence is unknown. But in Cameroon, there has been a recent or an increasing number of children being diagnosed with autism. A survey conducted among emergency department nurses confirmed limited knowledge and resources available for nurses to care for children with autism. Another study conducted by Samson Eta reported that psychiatric and pediatric nurses had low knowledge on autism. Pregnant women, on their part, have complained that nurses do not pay attention to their worries. Their wishes were often ignored during their process of birth. They were not involved in communication and education during their birth process. It is important for nurses to know that this special population of expectant mothers always experience exaggerated symptoms due to their condition. Thus, they have to be patient enough to render individualized care that is very supportive and gentle. Similarly, children with autism expect that nurses should have adequate knowledge and skill to implement strategies that are directed towards their unique needs. The problem is that despite the fact that the number of children with autism is increasing globally, nurses and midwives in resource-limited knowledge have little awareness and knowledge regarding autism. Women with autism may have particular challenges related to communication, decision-making, and sensory overload. It is worth noting that the core characteristics of autism, together with other associated behavior, may exaggerate their symptoms during pregnancy, and as this may hamper or prevent the delivery of appropriate nursing care. Thus, nurses may be facing challenges in caring for persons with autism, especially pregnant women and children. This paper intends to bring to the knowledge of nurses that these autistic persons suffer challenges in social interaction and they have heightened levels of sensory perception. And they should know that autism is one of the most challenging developmental disabilities that they may face in their day-to-day care or practice. And these challenges may be particularly difficult for women during pregnancy and during labor and delivery. Therefore, pregnant women and children with autism will likely behave differently from normally developing pregnant females and sick children. Hence, adequate knowledge of the core characteristics of autism will greatly improve the midwife's ability to provide quality care with confidence, and also pregnant women. And also highlight the best experiences, nursing care guidelines, and challenges faced in resource-limited nation. This is going to go a long way to improve awareness and knowledge regarding autism, enhance further research, and this will help nurses and midwives to adapt and modify care plans based on their knowledge on autism. This will in turn promote health equity and inclusion among individuals on the spectrum, and will in turn help improve pregnancy and birth experiences of women as well as the quality of care rendered to children with autism. These are some of the characteristics of children with autism. At 9 months, the child with autism does not respond to name. At 12 months, the child finds it difficult to play and interact with others. At 15 months, the child does not share interests. At 18 months, the child finds it difficult to point to parents to show things of interest. And at 24 months, the child may not notice when others are hurt or are being upset. Also, at 36 months, the child may notice other children around and may not join them in play. The child finds it difficult to pretend to be something else. We all know that at when children are going, as they go to school, some of them come back to school, they want to teach their mother, they want to demonstrate. The children with autism don't do that. Some of the early signs to know during the first year is that they lack sharing, enjoyment, or interest. And at 16 months, they may not be speaking. They also have, some of them might just be completely non-verbal at 2.5 years. And at this age, some of them, they throw objects and when they are unable to communicate their wants and needs. Autism in older children display them different symptoms. For example, they find it difficult making friends. They prefer just to be alone. At 4 also, the child may not be able to sing, dance, or act. Some of the symptoms you see or signs is that the child is fond of lining up objects or toys instead of playing with them as other children will do. And if you ask them to do certain tasks that they don't prefer, they will throw tantrums. At 10 years, you find a child with autism not being able to use language to communicate needs or even to learn. It is important to note that there are differences in between girls and boys. For the girls, they are more quiet and they may hide their feelings. You see, they appear to cope better, and that's why it is said in the literature that more boys are being diagnosed than girls. At 15 years, a girl with autism is outspoken with adults and peers, but may have difficulties taking cues from social partners and also has difficulties making friends. At 15, she sits on the chair, rocks back and forth. Now, for women, it's usually seen that these women find it very difficult to communicate during pregnancy, their wants, their needs. They are unable to communicate, and they find the process of pregnancy very, very challenging. We all know that pregnancy is a challenging moment, but with autism, it is very, very challenging for them. And in that case, they get so distressed and start waving their hands or finger in front of them repeatedly. They always show anxiety, stress, and most of them may develop additional psychiatric conditions, and complications have been reported. They have elevated rates of preeclampsia, prolonged hospital stay after delivery. Many of them may withdraw from treatment if they feel that the midwife or the nurse is being judgmental. They will withdraw from treatment. During their birthing process, they have difficulties communicating with the nurse or the midwife. They are unable to understand what is being said. They are unable to even communicate if they have some symptoms cropping up. They are not able to report. So there's a feeling of stress, anxiety. They are frightened in the strange environment where they find themselves, and this inhibits their further attempts to participate in discussions. Now, being an autistic mother is also a problem because in addition to their normal symptoms, the symptoms of pregnancy comes to exaggerate their presenting symptoms. So it makes it extra difficult, very, very difficult for them. Some of them are not able to plan and organize themselves to receive their newborn. they have difficulties understanding the process of birth. They always experience lower satisfaction rate with birth-related and postnatal healthcare services. They find communication very, very challenging, and they dislike their left sides being touched. They are very, very frightened when they see unfamiliar people. They fear unfamiliar men. They are also very, very sensitive to bright lights, strange smell, taste, and unexpected noises. They are very, very irritable. In their last trimester, they are very, very irritable, and they feel very painful contractions even level. So what do we do as midwives and nurses? It's important for us to provide quality care to all. So adapting an individualized intervention that will facilitate safe and effective care is very, very important. It is good to communicate more clearly to them and make adjustments as to be able for them to cope with their sensory and communication difficulties. So nurses should seek more knowledge, and midwives, they should go for more knowledge in order for them to know how to adapt and modify care plans for persons with autism. Also, it's important to help their communication difficulties by using pictures or picture exchange communication system. Is a strategy where instead of talking to them, and you can provide pictures to show, for example, it's time for medication, it's time for the pregnant woman to take a particular position. You show that picture, the picture of the corresponding activity for those that are non-verbal. Oh my God. Can you see my screen? Can anyone hear me? Jesus Christ.
Yes, we can hear you.
Okay, I'm sorry, my slides have stopped moving. Okay. So it's very important, sorry about that, it's very important to provide a one-to-one support. For example, rather than putting them in a very big group and talk to them or educate them, it's good to create smaller classes that will help them. Also, join a comprehensive plan is going to go a long way to help them understand the care process. And it's also good to put them in an environment where it's having a low light level, and unnecessary equipment should be removed from their room. Midwives should avoid touching them. Preferably, pharmacological pain relief methods should be used. Also, it's important to always keep voice very low when talking to persons with autism, and the speech should be steady. And we should give them a longer time to process information and answer questions. Questions that are not necessary should not be asked. For children, it's important to know that they find it very difficult to move from one stage of their development to the other, especially if they have to change their routine because they are very strict on their routine. So moving from their homes to hospital is already enough stress for them. So nurses should adapt strategies that will help them cope with treatment. It is advisable that at certain points in time, they might even try to imitate the repetitive behavior of children, so that it will help them to create a kind of rapport that will allow the children to receive proper care. There are challenges that we face in the resource-limited nation in caring for children with autism. For example, the lack of awareness and knowledge about autism amongst healthcare providers. There is need for greater understanding among nurses and midwives. So if we know more about who autistic people are, is going to give us the allowance to accept them and to create support and more quality care for them. And it will also give us the ability to be able to adjust our routine care plan and make it to be the patient-directed in a way that each individual with autism will receive holistic care which is adequate for their condition. Also, women have complained that they are not diagnosed. Some of them, they go and give birth before they even know that they are autistic. So if the diagnosis is made early and they know they are aware, nurses can take that opportunity to start in the ANC period, during the ANC period, to interact with the women and get prepared to receive their units. Also, barriers such as communication, differences in pain, expression, and sensory differences, we can plan care, adapt our plan of care to be able to accommodate these women. Also, the lack of knowledge about autism will further exacerbate communication difficulties. So we should note that the autistic woman may not be able to communicate his or her pain and her pain and her worries. So we should take time to listen to them. We shouldn't rush them in order to make sure they profit or benefit from the care that we are doing. And the care should be individualistic, unique for each woman. I will conclude by saying that there's a lack of awareness about autism among healthcare professionals. Healthcare professionals, especially midwives and nurses, should do all to improve their knowledge on the care of autism. This will go a long way to bring quality care to this patient population and also to reduce the stress and the depression that many women might go through. Some references. Thank you for your keen attention. Do we have questions? Sorry, I couldn't put on my video because of internet.